Dr. Kaitrin Kramer is up next, and she is a craniofacial orthodontist at Nationwide Children's Hospital's Cleft Palate Craniofacial Clinic. She completed her BS in molecular and cellular biology at the University of Illinois at Champaign-Urbana and received her PhD in oral sciences from the University of Illinois at Chicago. She received her doctorate in dental surgery from the University of Michigan and then completed a research postdoctoral training and was an adjunct clinical assistant professor at the University of Michigan School of Dentistry before heading to the Ohio State University for her certificate in orthodontics and MS. She then returned to the University of Michigan to complete a fellowship in craniofacial and special care orthodontics. She's excited to be back in the Buckeye State, joining the orthodontic and dental team at Nationwide Children's Hospital in Columbus, Ohio. Welcome back, Dr. Kaitrin Kramer. We're excited to have you.
Thank you, Sharon, for that very kind introduction. Can you hear me? Can you hear me okay?
Yes.
Thank you for that very kind introduction, and thank you for allowing me to be here today to speak with all of you. I'm really excited about it. I should also mention that I did my master's in Dr. Foster's lab, and so I had some experience there learning about hypophosphatasia, and I've really been able to try and coordinate that to talk to you today about orthodontics and HPP and what we know. So I am a craniofacial orthodontist. I am at Nationwide Children's Hospital in the orthodontic treatment program there. So when we say orthodontics, that term is really derived from the Greek word orthos, meaning correct or straight, and dante, meaning teeth. And orthodontics is a specialty field of dentistry, so this is some additional training after you're done with dental school that focuses primarily on malpositioned teeth and the jaws and how those relate to each other. We look at diagnosis, prevention, and correction of malocclusion, which is just another word for different bite or abnormal bite. When we think about braces, I think we generally think about this picture down here. I like to call those little stickers on teeth with different colors. And so that's our traditional sort of metal brackets. There have been a lot of treatment changes with clear aligner therapy, or maybe you've seen commercials for things like Invisalign. So those are the removable trays that come in and out versus the ones that stay on your teeth. And there have been many innovations in orthodontics where now you can get braces that come in different shapes and sizes. So you can even get your favorite sports team logo, I've seen, as well as some braces that actually stick to the inside of the teeth. So you don't see them from the outside, but this is all along the tongue side. So I like to tell people orthodontics is so much more than just crooked teeth. So when we think about how our teeth come together, the top teeth fit over the bottom teeth like a lid on a jar. And when that doesn't fit perfectly, sometimes you have an underbite where the top teeth are behind, or an overbite where the top teeth are too far ahead. Sometimes the teeth don't touch, and if that happens, that's called an open bite. And all of those things are things that we look at treating with orthodontics. So my specialty training is mainly in treating children with craniofacial anomalies, so things like cleft lip and cleft palate. And so for these kiddos, we're going to have sort of in long-term extensive orthodontic treatment plans that involve surgery throughout the course of their lifetime. And so that might be an expander, which some of you may have had or been familiar with, including braces, including surgery. And speaking of surgery, so orthognathic surgery is just a fancy term for jaw surgery. And what can happen sometimes is the top jaw and bottom jaw don't line up perfectly. And so what we need to do is work with surgeons to get the jaws lined up. And so we do the orthodontics to prepare the teeth so that when they line up the jaws, the teeth come together appropriately. So I like this slide just to remind everybody that celebrities are just like us. I was told that maybe not everybody knows who these people are, so I'm hoping they do and I don't age myself too much, but here's Prince Harry. He's got some clear braces on top and metal on the bottom that gave him his nice smile. And then Emma Watson here, who's got a gorgeous smile after her braces. And then Tom Cruise, who's like, I think the poster child for orthodontics, because if you look at older pictures of Tom Cruise, what we call our midline, so that's where our teeth line up relative to the center of our face, his was over to the left. And so he had braces to get that nice and straight there. So we like to bring up Tom Cruise for talking about why braces are important. So I wanted to do just a little bit of a background of how teeth move. And so building off of the image that Brian had shown earlier, here's our tooth. And here's our alveolar housing. So here's the root of the tooth, and then we've got the bone and the periodontal ligament, and then the cementum that's along the root of the tooth. And here's our bracket or our brace. And what happens is when you put a wire in, so that's what my patients like to say, feels like tightening of the teeth. So when a wire goes into the bracket, you feel a force. And what happens is the tooth begins to move. And as the tooth moves, on one side, you have this specialized cell called an osteoclast, which resorbs the bone or takes that bone away. And so that's the compression side. And on the other side, at the tension side, we have another specialized cell called an osteoblast that deposits bone. And so as that happens, you can imagine the tooth starts to move. So you remove bone on one side, you add bone on the other, and then there's this sort of equilibrium that's reached. And once that happens, then everything sort of reattaches nicely and the tooth has moved. So I bring this up because when we think about cementum defects that can happen in our patients who have HPP, we would think about how this would change, right? Because orthodontics really harnesses the body's natural response to force application. And if we don't have a housing that's intact, that may change. So I like to break down orthodontic treatment into sort of two stages. I think there's many other ways that you can look at this, but simply put, it's sort of early and late. And early is going to be in the mixed dentition. So that's going to be that timing that Brian talked about, where we have some baby teeth and some adult teeth. We don't do a lot at this stage. We really look for specific types of treatment. So that's going to be things like a crossbite. So again, how I mentioned the top teeth fit over the bottom teeth, like a lid on a jar. If the top teeth are inside, either in the front or in the back, we call that a crossbite. And so that's something that we would think about treating a little bit earlier. Any habits, like if our kids are sucking their thumbs or putting lots of things in their mouths, there's certain things that we can do to help with that. And then space maintenance, which I think is probably one of the most important ones and something that's going to be most relevant to our patients with HPP. Because what happens is the best thing to hold space are teeth. And so baby teeth hold space for adult teeth. And if you lose baby teeth early, teeth can sort of drift around and we may not have enough space, which can contribute to crowding. So that's what I would be thinking about in part of that early treatment. Now in later treatment, that's going to be in the permanent dentition. So when all of our adult teeth are in, I say anytime, but really it's going to be very patient dependent, but essentially when all of the permanent teeth are in, and we tend to say around 12 to 13, you can be thinking about full braces. Importantly, no cavities and no periodontal disease. So again, you have to have that intact alveolar housing and you want to have as healthy of gum tissue as possible because we want a solid foundation to be able to move teeth on. So unfortunately, and as Brian mentioned, there is just really not a lot of literature out there that can help guide our practice and tell us the best way to treat our patients with HPP. So just thinking about how orthodontics works and then thinking about where we might see changes in the dentition of our patients, we'd want to be thinking about maybe lighter forces and minor alignment. So not big movements if we can't really predict how exactly the teeth would move. Now, there is a case report out on a patient who had odontohypophosphatasia, and I do find these results very, very encouraging. So this patient's 20 years old, so he has periodontitis, which is basically sort of extensive gum disease that contributes to, that is characterized by bone loss, and that's secondary to HPP. So looking at his x-rays, these are top teeth and bottom teeth. What you can appreciate is there's a loss of bone. So we're missing bone around the teeth, up top and on the bottom. He had a lot of bleeding around his gums, and then he went through a deep cleaning or scaling and root planing, lots of oral hygiene instructions, and he came back every 2 months, which is pretty incredible because that's quite a burden on a patient. And after 2 years, though, of this pretty intense regimen, his periodontal condition stabilized. And because of that, they were able to do some minor tooth movement using braces. And so what they were looking for is being able to give him a more harmonic occlusion or get his teeth to fit together a little bit nicer so that he can then have dental implants. And so this is the patient at the beginning. And so you can appreciate here, we've got some irregularities with how the teeth line up. After 2 years, they were really able to give him a really nice smile and kind of straighten his teeth out. So minimal forces, monthly visits, and improvement in occlusion is what we see. So again, I find these results very encouraging, but this is one of very, very few papers out there that tell us anything about how we can use orthodontics in HPP patients. So to kind of summarize, I talked a little bit about how orthodontic treatment can happen at different stages of dental development. We know that teeth in HPP may fall out easily, so it's important to be thinking about things like space maintenance and how we make sure that there's enough room for adult teeth. And I'd be remiss if I don't talk about brushing and flossing, because I am a dentist. So I will encourage everybody to make sure you keep up with your regular dental visits, and conservative care can really make the best scenario. So keeping your tissues nice and healthy is really important. And then we really just need future studies to understand orthodontic forces on teeth, which brings me to talk about our HPP study. And so this is one of the big reasons I'm excited to be back here in Ohio and working with Brian and Dr. Griffin again. The study is still ongoing. If you have had any experience with orthodontics or implants, or know anyone that has, or even just had any interesting dental experience that you would like to share, please email us. So the email is dent-hppstudy@osu.edu. You'll probably hear back from me, and then you'll be receiving a pamphlet that you'll have to sign so that we have all of the appropriate consent so we can talk about your experiences. But we would love to hear from you, because we'd like to really create guidelines to help practitioners know how to predictably treat patients. And so I just, again, want to thank Brian and the entire lab group, and then our collaborators, Dr. Fields, Wright, and Nasidi, for all of the things that they did to help us with this. So thank you again.